Vital signs, pulse rate. The videos of Swot nurse notes serve as worded explanations and for demonstration purposes only. These notes are based on the owner of the channel's understanding. The channel's purpose is to assist with studying and to help with adapting to the UK clinical setting. These notes are short and simple for persons to better have a foundation knowledge to build on. This, however, does not serve as a specific guide to the NMC OSCE and CBT exams. Hi everyone. I am Nurse Swot, the owner of the channel. Today we will be looking on vital signs. To be more specific, pulse rate. Let's begin. Measurements of the 5 basic functions can be influenced by a number of factors. These can include age, medications, health conditions, and the environment. It is also used to assess one's general health and monitor treatment effectiveness. Measuring and recording clinical observations and calculating National Early Warning Score 2 can appear in the OSCE exams. You will be expected to correctly record these observations on the News 2 chart after the completion of vital signs during the assessment station. There are 5 basic functions that you are expected to assess during the assessment station of the OSCE exam. These include 1. Temperature, 2. Blood pressure, 3. Pulse rate, 4. Respiratory rate, 5. Oxygen saturation. Pulse rate, also called heart rate, is the number of times the heart beats per minute. An abnormal heart rhythm is called arrhythmia. Now, let's discuss pulse rate readings. These pulse readings are for adults. A heart rate over 100 beats per minute is called tachycardia. This reading would be considered abnormal. A heart rate between 60 to 100 beats per minute is the normal reading range. And a heart rate less than 60 beats per minute is known as bradycardia. This too is an abnormal reading. There are some medications that can affect the heart rate. These medications include fasting-acting bronchodilator, example, albuterol; methylxanthines, example, theophylline; beta blockers, example, carvedilol; cardiac glycoside, example, digoxin; and certain calcium channel blockers, example, verapamil. For this reason, an assessment of pulse rate should be done before administering these medications. For the OSCE exams, you should verbalize that you will palpate the radial pulse for 2 minutes, however 1 minute should be used to count the respiratory rate. Patient or client should not be made aware of you counting the respiratory rate prior to starting. Upon completing the count for the pulse rate and respiratory rate, notify the patient or client as to why they were not made aware. Rational awareness of the respiratory rate being counted alters the breathing rate, thus affecting readings. State verbally if readings were within or not within the normal range. Remember to state the pulse rhythm, whether it was regular or irregular. Also state the pulse strength, was it weak, strong, bonding, or absent. For the OSCE exams, you are required to do the vital signs at the assessment station. The assessment station is 20 minutes. After completing each vital signs, always state if the readings are within or not within the normal range. Ensure that you document readings on the National Early Warning Score 2 chart before the 20 minutes is finished. Based on the News 2 score, please indicate verbally the monitoring frequency hours and if escalation of care will be done. Explain the rationale behind escalating or not escalating care. Remember to write the date, time, your initials, and signature where required. Document correctly on the National Early Warning Score 2 chart. One simple error will be an automatic fail for the assessment station. Remember, if readings are abnormal, you are expected to escalate care. Read charts carefully to ensure you're writing in the correct section. The frequency of monitoring of vital signs for care plans are based on the National Early Warning Score 2 News 2 Total Score. Recheck as often as possible to ensure you have completed charts correctly. Remember, vital signs are a part of the assessment station. You can decide whether to do it before or during the AT assessment, fulfilling the criteria. Remember to manage your time. Now, how do you document the pulse rate reading on the News 2 score chart? First, look for the section that states C pulse beats per minute. The C stands for circulation. Based on the pulse reading, look for the row and column in which the reading belongs. Note carefully that the readings are set within ranges on the News 2 score chart. Please observe carefully each row. At the end of each row, there may be a score. Scores can be from 0 to 3. Now let's use examples. Example 1. Let's say you got a reading of 85 beats per minute. Where would you write this finding? As seen on the chart in black. You would write it in the section, row, of 81 to 90 beats per minute. Please note the score at the end of this row is 0. Why this row? Because 85 falls within the range of 81 to 90 beats per minute. You can either write on the chart using numbers, or you can place a dot in the required section to signify where the reading would fall. Example 2. A reading of 111 beats per minute. Where would you place this reading? As seen on the chart in red, this reading would fall in the range, row, of 111 to 120 beats per minute. Please note the score at the end of this row is 2. I hope this was all clear. An upcoming video will be done on how to document on the News 2 chart in full. Remember to subscribe to the channel to get post notifications. Thank you for watching.